celebrate the new catheterization laboratory tonight, which you'll get to see. So it's my first slide. I think you're all familiar with Kirk Cousins. And this is my disclosure slide. I'm not a professional athlete, so I thought I would just kind of clear that from the room, just in case anyone was wondering. Kirk Cousins has done an excellent job in championing the sports medicine program here at Holland Hospital. And but over the years, you know, I've noticed that some of the quarterbacks in the NFL are starting to look a little bit more like me. So anyway, this is Peyton Manning, Tom Brady, and our own Matthew Stafford. So I give Kirk Cousins another 5 years and he'll be joining the Bald is Beautiful Club with me. So anyone know what this is? Does this look familiar like the old neighborhood? Not to me, but this is 1957, so it predates me a few decades. This is Holland Hospital. But more specifically, I thought we would talk about their heart program. So to get started, in 1998, the first catheterization laboratory was opened. And at the time, all they offered was diagnostic studies, meaning that diagnosis could be made, but no angioplasty or stenting procedures were performed. So it was purely to get information and diagnosing patients. And you can see a picture of that here, some of the primitive equipment that they had. In 2001, pacemaker implantations were moved from the operating room to the cardiac catheterization laboratory, so increasing the volume and what they had to offer. And in 2002, peripheral vascular interventions were starting to be performed at Holland Hospital. This is a gentleman with circulation problems in his legs. So this is all types of problems and procedures outside of the heart. So this can be patients with circulation problems in their legs, their kidneys, their belly or their mesenteric vessels, and their arms or the subclavian vessels. So this again is another milestone in what they were offering the community here at Holland. This is probably the major milestone. In 2005, and somewhat controversial, they developed primary coronary intervention in May of 2005. What this means is this would allow a local hospital like Holland to treat patients that present with a major heart attack that meets certain criteria. Now, typically these patients would have to be transferred to a larger tertiary facility to receive treatment. But it meant that they could be treated here safely, undergo a stent procedure. And this was done also, again, the controversial aspects of it, where there was no cardiovascular surgical backup here on site. So this was something that was a little bit new at the time and somewhat controversial, but has been a very, very successful program ever since it was launched. So we've been very proud of the success in treating patients presenting to Holland Hospital with major heart attacks. So even this year, 2017, one of the major benchmarks or quality measures that we look at is what we call door to balloon time. How quickly can we treat patients that present to Holland Hospital? And the national benchmark is 90 minutes. And for this year, we're at about 56 minutes. So we are doing an excellent job in fulfilling that mission. You can see our official work shoes here. So speed's important. So as of 2017, 100% of our patients that have presented here, again with major heart attacks, have been treated under 90 minutes. So again, something we're very proud of. Kind of moving on, 2006, a new catheterization laboratory was built here at Holland Hospital, which we're using. And in 2009, a interventional radiology suite was also added to the hospital, where peripheral vascular interventions could be performed. In 2016, again, another major milestone. Holland Hospital started to perform its first elective coronary stent procedures in April of 2016. Again, what this means is these are patients that are coming in not having heart attacks, but are coming in and undergoing stent procedures, again, without surgical backup, meaning no cardiovascular surgeries on site. And this has been a very safe and effective program, something that we're very happy to offer the community, keeping the care here in Holland. So to date, 2017, Holland Hospital is on track to perform over 250 coronary stent procedures, something that I performed, over 900 diagnostic catheterizations, and in totality, over 2,000 invasive procedures. So you can see over the years, they've made a tremendous investment in their heart and vascular program right here at Holland Hospital. So again, Holland Hospital has continued to invest as far as commitment in the community with the goal of keeping care here locally. So, oh, sure. So that's what we're here tonight, to have you take a tour and see the new world-class facilities that Holland Hospital has built. Again, these will offer us or afford us the ability to offer more procedures to the community. And what this means to you is, again, keeping more care here locally at Holland Hospital. Less need of transferring patients out of the community to tertiary centers like Grand Rapids or Muskegon or Kalamazoo. So I think this is a real important step and investment in this hospital has made. So these type of procedures I'm talking about, again, are pacemaker implantations right here at Holland Hospital, defibrillators, biventricular ICDs. Again, these are defibrillators for patients that may have congestive heart failure, implantable monitors, all forms and aspects of coronary angioplasty and stents. And as I talked before, expanding, expanding our service line for peripheral vascular interventions. So legs, arms, kidneys, and belly procedures. This also, again, this investment in technology has to be coupled with an investment in our staff, and so we're very proud of our world-class staff that we have here, who will be giving you tours tonight to see the new facilities. So they're very knowledgeable and are taking time out of their schedules to do this for you folks tonight. Now, a new program that Holland Hospital will be launching this fall is inspired by the new American Heart Association recommendations for physical activity. So these recommendations are 30 minutes of moderate exercise 5 days a week, so that's 150 minutes, or 25 minutes of vigorous exercise like running 3 times a week. And then they also emphasize high intensity training such as weightlifting, that sort of thing, twice a week. The benefits of a walking program are to reduce serious diseases such as heart disease, stroke, diabetes, cancer, improve blood pressure, blood sugar, blood cholesterol levels, increase energy and stamina, improve mental and emotional well-being, improve bone strength, and prevent weight gain. So there's a lot of very positive aspects of incorporating physical activity into your daily schedule. So this cartoon kind of sums it up. What? Cut red meat out, caffeine, start walking 10 minutes a day. Are you trying to give me a heart attack? Well, that's exactly what we're trying to do. So this is the new program. It's going to be launched Saturday, October 14th at 9 a.m. at Windmill Island. And Dr. Tyler Murphy and Matthew Hilton will be leading out. It is a Walk with the Doc program, so they'll give a little talk about something related to prevention and then do a walk with whoever shows up. The first 50 people receive a free gift. So my understanding is they're planning to carry this on a weekly basis throughout the fall and winter months. So another offering from the hospital for you folks. Recommended reading. Last time I talked, several people came up to me and wanted to know what book it was that I had referenced. Last time I gave a talk about prevention. This is great reading. If you like to read or you're getting a book for the fall, this is a great read. It's called The Blue Zone: Lessons for Living Longer from People Who Have Lived the Longest by Dan Buettner. So if you're interested, so the whole premise of this book is looking at individuals, centenarians, so patients or individuals that have lived over 100 years, and trying to figure out what it is that's unique about them as far as their environment, what is it they do, their diet, their exercise, what's the secret there. So these are just a few of these individuals, and they call them longevity hotspots. So the United States has one. Loma Linda, California has a population of centenarians, or a large concentration of individuals living over 100 years. Costa Rica, as you can see, Italy, and Japan. Nothing is, they're all near the equator, which is, I guess if you're thinking about moving to Alaska, then you might. So there is 9 features in this book that you'll learn about as far as characteristics or themes that all of these kind of longevity hotspots have in common. One is decreasing stress in your life. Second is having a purpose. And again, I don't know how they would quantify this to adding up to 7 years in your life, but I feel that, again, individuals that have a purpose every day. And this is interesting, again, the population in Japan, they don't have any real concept of retirement. So their entire life, they are a useful individual. At 65, nothing happens. So they seem to think that that is kind of a useful model as far as having a purpose throughout your life. Another common feature is a plant slant, meaning just they tend to eat less meat and more plant-based diet. Again, there's a little group in Italy that tends to have a little alcohol every day, so that's controversial a little bit, but that's at least something that they have in common. Family first, 80% rule, again, is eat mindfully. They recommend you stop when you're 80% full. That'd be a tough one for me, but move naturally. A lot of them are not athletes per se, but they always be active throughout their lives. It says be part of the right tribe, surround yourself with positive people, and have a sense of belonging. So anyway, this is a read that I would recommend for this fall, and here's Dan Buettner as the author. And let's see here. So I'd just like to leave you with this thought here. The aim of medicine is to prevent disease and prolong life. The ideal of medicine is to eliminate the need of a physician. So that's all I have tonight.